Hello, my name is Vanny and I'm the program founder and advocate of the Specialized Doula Care for Black Birthing People. The problem that my innovation solution is combating is Black maternal mortality and morbidity. In the United States alone, Black women are 3 times more likely to die during childbirth compared to their white counterparts, despite neglecting pre-existing conditions. Black birthing people are also more likely to experience life-threatening conditions, including preeclampsia, postpartum hemorrhage, blood clots, preterm birth, and low birth weight for their babies. Additionally, Black women face medical neglect, undress pain, and implicit bias that all impact their quality of care. Ultimately, the foundation of modern gynecologic techniques were pioneered on enslaved Black women without anesthesia or consent, leading to the continuous neglect of our community. The significance of this issue is that 70 Black women die for every 100,000 births. More importantly, 46% of these deaths are considered preventable. So my solution is an online community-based doula program specifically to meet the needs of Black women in high-risk areas. The specialized training will consist of foundational understanding of gynecology and maternal health disparities, recognition in early intervention strategies for conditions such as preeclampsia and postpartum hemorrhage, cultural competency training to ensure doulas can effectively advocate, trauma-informed care techniques to provide emotional support and psychological support tailored to the needs of Black birthers. All of these factors will lead to decreased maternal mortality and morbidity in the Black community. In order to make my products successful, I must have a community-centered, equity-driven, and informed by lived experience model. This means engaging directly with communities in which I plan to launch the program with doulas, healthcare providers, and community organizations. By co-creating with those on the front lines, I will ensure the program is not only culturally relevant and responsive, but also sustainable, trusted, and truly transformative. One cannot have a community-driven product without collaboration. That is the key to success in my leadership style. So the outcomes and evidence, I will make sure to ensure the continued success of my program through a series of tests that will be conducted to gather metrics on whether to keep what to keep in the solution and what to change. The first being a qualitative comparison study that involves a cohort of Black birthing individuals all residing in the same geographic area. There will be 3 groups of participants, a control group with no doula care, a group receiving traditional doula care, and a third group that has traditional doula care with the addition of my community-based model program. At the end of the survey, the doulas will, or the participants will answer specific questions regarding their care, such as did they experience any changes in anxiety, stress, or overall comfort? How likely are they to recommend the doula and the specialized doula care, and if they feel emotionally supported throughout the week? The second is a cost analysis. This will use hospital records and billing data, the rates of C-sections, NICU admissions, emergency interventions, length of hospital stay, and any other unforeseen procedures will be evaluated in these high-risk areas with the goal to examine costs related to maternal care to demonstrate that the implementation of a culturally competent doula support cuts the cost significantly. So not only are patients benefiting, so are the institutions working with our program. The third is a knowledge-based test to assess whether the program adequately equips doulas with the knowledge and skill sets needed to support high-risk Black birthing populations and better patient outcomes using a pre and post test knowledge assessment. The fourth test is to directly measure the impact of maternal health outcomes over time, with the key metrics including rates of maternal morbidity and mortality, postpartum complication, child health outcomes, and patient-reported wellness measures. All of these tests will be taken over a 2-year period to ensure sufficient sample size and to observe changes over time. The findings will guide the iterative improvements, while the final results will determine the program's long-term viability and scalability. So the business model, more specifically the finance of this product, will be funded and sustained through the Arizona Medicaid 1115 waiver program, which is for transformative projects intended to advance member health and outcomes. This will allow Black birthing people to have specialized doula care during pregnancy, childbirth, and postpartum recovery, specifically those who need or qualified for Medicaid, because they are typically in the high risk areas that we are looking for, and we want to make sure that this is a fully funded program. Here are my citations, and thank you for listening.